Hello, Miss Doe, correct? My name is Renita and I'll be explaining your MOS procedure today. How's your day going so far? Do you have any existing health conditions we should know about prior to your surgery? Okay, so the purpose of the surgery and goal is to progressively remove thin layers of the cancer containing skin cancer until only cancer free tissue remains. We will be removing the basal cell carcinoma cancer today. Basal cell carcinoma occurs in the deepest layer of your skin, also known as the basal layer. The cancer arises from cumulative and intense sun exposure. Due to this exposure, the skin's basal cells will abnormally grow uncontrollably and create lesions. A dermatologist will perform the surgery, so you have nothing to worry about because you are in very good hands. Here's what happens during the procedure. So the first step, since the target location is on your cheek, you will remain clothed during the surgery. The dermatologist will then mark the spot where you had your biopsy with a pen. Then a surgical drape will be placed over the area. The dermatologist will then inject a local anesthesia, which will numb the area completely, but you will remain awake during the procedure. A scalpel will then be used to remove a thin layer of the cancerous tissue. Because some skin cancers may be more than meets the eye, a lab analysis is the next step to determine if more skin cancer tissue remains. While the lab work is being done, your wound will be temporarily bandaged. The next step after that, the dermatologist will then cut the tissue into sections, color code them, and draw a map of the surgical site. In the lab, a technician will freeze, cut, examine the tissue under a microscope. And then the dermatologist will examine the slide as well as look for any remaining cancer cells. Then mark those cells on the map as previously mentioned. It is at that stage when the doctor will tell you if we need to remove another layer. If needed, a dermatologist will inject more anesthesia on the map to remove the remaining cancer cells. Then the tissue is sent to the lab again and the wound is temporarily bandaged. This process is repeated until all the cancer is gone. Once all the cancer cells are removed, the dermatologist will immediately close the wound with stitches. This process can take up to several hours depending on how many rounds are needed to remove the cancerous cells. So now I will tell you the risk about scarring. The risk factors of scarring are some that you can control and some that you cannot. Age and genetic factors, size, depth of the wounds are the ones you can't control. The factors you can control are the ones I would worry about because this will help speed up the healing process. What you can control is your general health, taking care of the wound. Although you cannot change your genes or age, you can eat well, sleep, hydrate, and take care of your wound to reduce any scarring. Any action you take to promote proper wound healing reduces the risk of excessive scar tissue forming and resulting in a prominent scar. For optimal results, please follow wound care instructions carefully. Leave pressure dressing in place for at least 48 hours unless instructed otherwise. This will protect the wound from dirt and other external elements. It also applies pressure while absorbing the wound drainage and keeping the area moist. Lubricating the wound with specific ointments will promote healing wounds, as wounds heal better when kept moist and covered. Patience is key. It may take up to 6 months to completely heal after surgery, so be sure to take extra care of your skin in the meantime. Wear sunscreen, minimize sun exposure, and avoid tanning beds. Please return in 1 week to have the stitches removed, and if they are not ready, then we will wait another week. Any questions? Awesome. I wish you luck with everything. Have a good day.